Are you or someone you know going through menopause and considering hormone replacement therapy, also known as HRT? It's time to clear up some confusion and get the facts straight about HRT. Benefits of HRT. HRT can effectively reduce common menopause symptoms such as hot flashes, night sweats, and vaginal dryness. Studies suggest HRT helps maintain bone density, reducing the risk of osteoporosis and fractures. HRT can improve mood swings and sleep disturbances associated with menopause. Risks of HRT. Some studies have shown a slight increase in the risk of breast cancer and ovarian cancer with long-term HRT use the older you are, suggesting the earlier you start hormone replacement therapy, the better. Hormone replacement therapy, or HRT, may increase the risk of blood clots, so discuss with your healthcare provider what course of action to take to see if hormone replacement therapy is right for you. There is some evidence linking HRT to an increased risk of heart disease, especially in older women or those who start HRT later in menopause. Debunking myths. Myth 1. HRT is only for severe symptoms. Untrue. HRT can be tailored to individual needs and used to manage a range of symptoms and not just the severe ones. Myth 2. HRT causes weight gain. Also not true. There is no direct link between HRT and significant weight gain. Myth 3. Natural remedies are always safer. Not necessarily true. Natural remedies can be beneficial, but are not always regulated and may not be effective for everyone. For instance, many functional medicine physicians and naturopaths treat menopausal patients with natural remedies. However, unless you're under the guidance of one, please use caution when going this route. Moreover, HRT is only available through medical supervision. Is HRT right for you? The decision to use HRT is highly personal and should be made in consultation with your healthcare provider. Consider the following. How severe are your symptoms, and how are they impacting your daily life? Do you have any health conditions that might increase the risks associated with HRT? What are your preferences regarding treatment, and what are you hoping to achieve with HRT? HRT is not a one-size-fits-all solution, but it can be a powerful tool for many women navigating menopause. Always discuss with your doctor to weigh the benefits and risks based on your unique health profile, as well as your family history. Let's spread awareness and support each other through this journey. Share your thoughts and experiences in the comments below. Thanks for stopping by and visiting Cam's Purple Corner. For more content, don't forget to like, share, and subscribe. Bye!